Okay, guys. So welcome back to the Health Hour. We run a very successful series of episodes in Ramadan, and by backed by popular demand, I guess we're here with our fifth episode, which is called "Hear It from the Frontline Heroes." And first of all, thank you to COLABS for organizing this. I'm Noor Hiramer. I'm the co-founder of Sustainable Sehat, and I will be your moderator for this session. Today on the panel, we have three very dedicated doctors with us. I'll quickly go into introductions and then we can dive into the discussion that we have regarding the situation. So, first up, we have Dr. Amara Mushtaq. She is an infectious diseases fellow at Econ School of Medicine at Mount Sinai, New York. Second, we have Dr. Tabish Raza. He's a senior registrar at the Services Hospital, Lahore. And last but not the least, we have Dr. Kamal. She's a postgraduate resident at Shifa International Hospital, Islamabad. So, thank you guys for joining us today. I know it must be really tight schedule for all of you, and taking time out for this session will, I'm sure, benefit a lot of people who are listening to all sorts of information from so many people. So, first things first, I'll quickly dive into questions, and I will look at Dr. Tavish Raza first. Dr. Tavish, since you work in Lahore and at Services Hospital, and I think this was one of the first names that came, the hospital, I mean, when the coronavirus testing started and people used to go there. I think they were the government facility that were offering the testing for free. So many months down now, what would you say? Would you shed some light on the current situation of a hospital setting in Lahore when the virus is sort of at its peak in Pakistan right now?
Yeah, Pakistan में our first case came around February. It was 26th of February, and
Hmm.
Services Hospital was the first hospital which was actually nominated to manage coronavirus patients in Lahore.
Hmm.
So they started to turn up in Services Hospital around March. शुरू में, of course, we had very few cases,
Hmm.
and but in Pakistan, we actually didn't have any dedicated infectious disease hospital before this.
Hmm.
And till now, unfortunately, we do not have a dedicated infectious disease unit as such.
Hmm.
What's the current situation at this time? I would say about 50% of services hospital is dedicated for the coronavirus patients or the COVID
Hmm.
19 patients. Like
Right.
we have our medical emergency is no longer a medical emergency. It's I call it a COVID emergency. We have
Hmm.
about 60 beds there, and uh, recently, for the last 2 weeks, there has been a slight decline in the number of cases that are coming to us in the medical ER every day.
Oh,
But
okay.
on the 12th of June, I was in the medical ER in morning, and I
Hmm.
remember all the 60 beds were full, and then we had
Hmm.
10 of patients on the stretchers, and there were 3 or 4 ambulances parked outside with patients on oxygen waiting for a bed to uh,
Yeah.
uh, be arranged so that they can be shifted
Yeah.
inside. So at present,
Hmm.
Services Hospital, we have the medical emergency. We have converted our CCU, our pulmonology ward, one of our medical unit, which is medical unit 2, our dengue
Hmm.
isolation, our first corona isolation ward is still our corona ward. We have
Hmm.
14 rooms which we have converted to corona wards. We
Yeah.
had a new building. We have converted 2 floors of that into a corona ward. So we have around 12 areas which are dedicated for the coronavirus patients. Plus, we have established a new COVID ICU.
Oh,
It's a
okay.
2-floor ICU,
Hmm.
and we have capacity of about 32 patients in our COVID ICU. And even the other areas which we are using for the coronavirus patients, they are actually HDUs. So they are high dependency units and
Hmm.
all have facilities for high flow oxygen. And so, well, we have a lot of patients now, and जो लोग कहते थे कि जी कोरोना इज
है
अ
कि नहीं
स्कैम,
है, हाँ।
होक्स और सब कुछ, अगर वो सिर्फ हमारी मेडिकल ईआर से एक दफा राउंड लगा के चले जाएं तो आई थिंक के वो शायद कमरों से भी बाहर ना निकले।
नहीं, ये आप बिल्कुल ठीक कह रहे हैं, because there's been a lot of misconception about whether it really exists or not. शुरू में तो, अब तो I hope people are realizing that it is very real. और
Yeah.
शुरू में मुझे भी था कि maybe people who are not as well educated are probably thinking that it doesn't exist, but then I figured that it wasn't really the case. तो खैर अब आई एम श्योर थिंग्स आर चेंजिंग। इसी बात से डॉक्टर कमल, माय नेक्स्ट क्वेश्चन वुड बी फॉर यू। इस्लामाबाद में एक तो ये कि बिल्डिंग ऑन डॉक्टर ताबिश's व्यू कि उन्होंने थोड़ा सा बताया कि लाहौर में क्या सिचुएशन चल रही है हॉस्पिटल में, बीइंग ऑन द फ्रंट लाइन वेरी स्पेसिफिकली, how would you, can you walk us through what a day looks like for you in a hospital setting in Islamabad?
So thank you so very much, first of all, Ms. Noor Hera. And yes, I totally agree with Dr. Tabish Raza. He has given a very good overlook of what's happening in Lahore. So here, being in the private setup, the situation is not that different as from the government setup. We are facing initially it was a very different situation because हमारे हॉस्पिटल में इतना एक्सेप्टेंस इनिशियली नहीं था, क्योंकि एक्सपेक्ट नहीं करी थी, पीसीएस नहीं थे. I'm taking you back to the 4 months before, जब इतना हमारे पास facilities नहीं थी and all. But now, being in the radiology department, we have seen cases just we look into the lungs of the patient, and it's a horrendous picture. They do not know कि कितना lung destroy हो चुका है with this viral disease. So yes, the number has pretty much increased immediately after Eid, keeping in view how people have been violating the SOPs and social distancing and all. And secondly, most important is that even the families who were who said to have been in a very complete isolation, they still had it. So yes, we need to be more cautious about it. Secondly,
यही आपकी बात, sorry, I'm cutting you.
No
मैं कही थी कि if you could walk us through what a day looks like when you enter the hospital, what the situation is, you see patients, what feelings you have, and then you come home, how that sort of changes your perspective.
All right,
I think
so it's a complete physical and mental exercise, to be honest. It starts with physical when we enter the hospital with all the PPEs, with so many masks, not one, two. In fact, we are having the 3 layers of masks and having sanitizers all along the corridors. The number of corridors maybe हमारा sanitizers का number increase हो गया है. We see people who are wearing masks. तो इतना एक अजीब सा horrendous सा एक alien type की feeling आती है. We cannot smile to each other. We cannot say good mornings and assalamu alaikum in a happy way anymore. And then when we are greeting the post-call team, so they tell us कि इतना ज़्यादा number of COVID हमने आज रात को पढ़ा है, इतने COVID हुए हैं, because we have dedicated HRCTs for COVID-19. Because the patient PCR आने में थोड़ा सा time लगता है, तो there are certain findings about we categorize them कि ये typical है until the PCR comes around. So yes, because we are in the direct contact with the ER medicine team, तो जाहिर है it's very saddening. और फिर हम mentally भी थोड़ा exhaust हो रहे होते हैं, because we are seeing people from teenagers to 40s and 50 age or post 60 age diabetic hypertensive with so many comorbidities. But yes, it's a complete mental and a physical exercise, I must say.
That is a great insight. Obviously, मतलब अभी तो हम घर में we're in complete isolation and we're only going out for very important tasks, but still it's so much exercise to completely, it's so much mental stress as well when you're taking so many precautions and you can't do what you thought was a basic human need, like hugging or shaking your hands or just smiling at someone.
Absolutely,
right?
Absolutely.
Which takes me to my
sure.
Yeah,
you make on. Okay, so Noor, I will add one more point, that when I come back, I have my nieces at home and they just immediately hug me in the usual days, but now we just cannot. पूरी एक मस्जिद बनी होती घर के बाहर चप्पलों की, और then we have to sanitize ourselves first and go to the washroom and just change immediately and then come and meet the families. So yes, every day is a very tiring day, both physically and mentally and emotionally.
Which take me to my next question. Dr. Amara, आपसे मैं ये पूछना चाहूँगी. Um, we had a very informative session with some panelists last time, our fourth episode, and it was a revelation to me when one of the doctors from America, he was as well, he said that the strain is sort of so mutative that it's changing shapes from country to country. For example, it has shown effects on American population in a different way than it has on the UK population or on the Pakistani population. But every day, like social media is full of the number of cases that's increasing in America. So even though it's like a first world country and they probably should be dealing with it better than a third world country, but everybody is in a haystack right now. But still, what would you say, why is it the situation is like that in America, and how would you compare it to Pakistan?
Yeah, so obviously in America, too, the situation is, it was horrendous. It's starting to get better now. So there are certain states where numbers are increasing, and certain states, some in New York City. New York City had been through the worst, and now it's getting much better. We're beginning to reopen. So it's a lot better now. But when it was at the peak, yes, it affected all of us. You know, it was very difficult to get groceries. Grocery stores were running out of items of everyday life, paper towels and other cleaning stuff. Just like in Pakistan, there were no hand sanitizers. You couldn't find hand sanitizers, and people were stocking on stuff.
Okay, I hear that.
Yeah.
But just building on that, do you think that, for example, we have a general, mindset over here in Pakistan that maybe, Americans are more aware of the situation. They follow more rules, or they stick more to the SOPs. So how would you say that? Is it true? Or do you think people tend to be reckless anyway, no matter where they are from? How would you, comment on that and compare it to Pakistan?
Yeah, I think so. Just in terms of following rules, I would say it was probably better observed in the U.S. than Pakistan and some other countries. But because where I was in New York City, it's an international population here, and there are a number of flights coming from Europe and China and all over the world. It's an international airport and a major tourist destination. So I think that was a key reason why the numbers went so high, that we were not prepared. So the level of unpreparedness in our hospitals was probably the same in Pakistan. You know, we were short of bed, we were short of ventilators, we had to really think who needs to be ventilated. So patients who would otherwise would be ventilated, now
it sort of becomes like an opportunity cost, right?
Yeah. You'd see if there are other patients. You have to triage your ventilators. Who needs it the most? Not who needs it, but who needs it the most. And then you would use BiPAP instead of ventilators, which is also a ventilation device, but just a different one. So the level of unpreparedness in our intensive care units was also phenomenal, and a lot of unpreparedness. But then we were able to get over it eventually, especially in this state. Because we were, following guidelines. So nobody was going to work, only essential workers were going to work, and it was an executive order, an executive law. So it was like a law, you couldn't violate it. Then wearing a mask became a law too. So most people wear masks. Yes, there are some people who don't, but most people do. And then all stores like pharmacies, essential businesses that were open, like post offices, pharmacies, and grocery stores, they were implementing strict social social distancing guidelines
Yeah.
do, because you would have to be 6 feet apart from each other. So there would only be a certain number of people in store at a time. You would
Yeah.
have to stand outside in a queue. I have done that when I needed some
Yeah.
medicine from pharmacy. I had to stand in a queue. And then like outside the store, there were lines to show that this is 6 feet. So you would know what 6 feet is, and then you would stand 6 feet away from each other. And
Yeah.
similarly, that would happen inside stores too. So because of
Mm.
all those measures, we were able to
Mm.
get over it, and now things are much better. Our barbershops are opening up, routine businesses are opening up, parks
Yeah.
are open, playgrounds are open. So
Mm.
and then but then we're still following like social distancing
Yeah,
guidelines,
of course. Mm.
wearing masks. But in some other states in the US, like Texas, the
Yeah,
numbers are
Texas, I
getting
heard
worse.
yesterday. The
Hmm.
numbers are still increasing.
Yeah. So anyone who
Yeah.
comes to New York City from one of the states where numbers are going high, they have to quarantine.
Yeah, okay. Makes
Yeah,
sense.
for
Hmm.
14
Okay,
days.
building on that, I think that is some sort of a positive news, considering that at least, we're getting somewhere with it, which brings me to my next question. Dr. Tavish, a lot of news I've seen on social media where people are saying that the number of cases are sort of not increasing as much as they did pehle. Um, or I keep checking the government's website as well, where they, update the number of cases as well. But then again, from a doctor's perspective who goes to a hospital almost every other day, do you think the situation is going towards a progress in terms of, are we going somewhere? Is this getting better? What sort of a timeline do you see कि मतलब अगर अभी हम इस पे हैं तो थोड़े दिन बाद कहाँ होंगे, या इस तरह की कोई आप थोड़ा सा बता सकें in easy words for a
Yeah.
layman to understand.
Yeah, okay. Initially in Pakistan, we had several theories, and we used to think that Pakistan has low numbers because we are immune for some reason, or we have had a BCG vaccine which gives us immunity, or we are a malaria prevalent country, or we have hot weather, and there were numerous theories
Yeah.
which we had, which were giving an explanation why our cases were low. Actually, we were just behind the United States and other countries. All of these theories were
Yeah.
actually incorrect. And now, when we see on the ground, even I personally think, rather, I know that the numbers which we have officially are incorrect. The actual number of cases are a lot more than the numbers you see there. There are two reasons for that. One is that here in Pakistan, it just stopped now, but about a month ago, it was happening that anybody who was testing positive was picked up by 1112
Yeah.
and all police, and
वो
they were
एक
taken to the
बिल्कुल डर बैठ गया ना
yeah,
लोगों के दिमाग में, तो उन्होंने टेस्टिंग करवाना छोड़ दी.
yeah. So हुआ ये कि people were locked up. The head of family would be picked up. He would be shifted to the hospital. The other family members were locked in the house, and they were tested. And ऐसे incidents भी हुए कि the children were taken to children hospital. The male member was taken to Expo hospital, and the female was taken to Mayo hospital. So एक phobia developed हो गया, and people stopped getting tested. So the stable patients were not getting tested. So you got very low numbers. फिर जो दूसरा प्रॉब्लम था वो ये था कि इवन हमारे जो सिक पेशेंट्स थे, बहुत सारे सिक पेशेंट्स वर नॉट कमिंग टू द हॉस्पिटल. एंड एक यहाँ पे रूमर था कि जी डॉक्टर्स टीका लगा के इंजेक्शन लगा के मार देते हैं, and
हाँ, ये वाला.
he will die.
And
So actually there were a lot of patients who were brought in dead in private hospitals of Lahore and in government hospitals. 12th जून को मेरी जो मॉर्निंग इमरजेंसी थी उसमें 8 people were brought in dead, and they had a history of disease like COVID-19. So अभी तक ये हो रहा था कि a lot of people were dying at their houses. अभी क्या हो रहा है, जून के में क्या हो रहा है, we have patients who just come in, and they're so sick that as soon as they come in, they die in an hour or so. And then there are a lot of patients who die within the next 24 hours. And then hamara procedure, a patient comes in, we manage the patient in the ER, we admit the patient to a dependency unit, then we send the PCR, and eventually when the PCR comes, then we label the patient to have COVID-19. And then if a patient dies, then that patient is actually labeled as a COVID-19 patient. So, ho ye raha hai ki when we actually declare that we have had one COVID-19 death, there are actually 30 COVID-19 deaths behind that one death, because all affected cases are not labeled because we do not have a confirmed COVID-19 report. I'm not sure if that's the same thing happening in the United States or not, but that's what's happening in Pakistan. So now what's happening now is that we expect Dr. Yasmin Rashid, the Health Minister of Punjab, she visited our hospital a few days back. And she also said, and personally what we saw in the hospital, that 12th June was the day when we had the maximum patients in our hospitals. We had around 160 admitted patients in our hospitals, and our emergency was full, as I mentioned earlier. Then I've talked to a lot of doctors who do private practice. I've talked to a lot of GPs, and the GPs say that they were getting around 300 stable COVID patients every day. Like one of my friend, he's a very good GP in Lahore. He was telling me that around the mid of June, he was seeing 300 COVID patients per day. And that number has been gradually declining. And now, day before yesterday, he was telling me that he got around 70 to 80 COVID patients in 24 hours. So we are seeing a decline of patients in the GPs, the GP setting, and also in our hospitals. Plus, if you see the government figures as well, you see a downward trend in both the mortality, in both the new number of cases, and also in the number of critical patients. So I feel that the patients are finally declining. There was a study carried out by government of Punjab. They tested 29,000 people randomly in Lahore, and they estimated that 670,000 people in Lahore have been affected. And this study was completed on 30th of April. So if
and is it authentic?
Yeah, that was a study which they did because it was a random sample of 29,000 people. Now, if I interpret that study, I would like Dr. Mara to shed light on it later as well. The sensitivity of years with nasopharyngeal swabs is only around 67%. And when we do it in our setup in Pakistan, it's probably not as good because the person who's testing is not that much of an expert as he should be. Then he does not preserve the sample in the correct way. It's not transported in the ideal manner. We have the samples are run after a long time. And so I personally think that we missed 50% of the cases. So I think that on 30th of April, we had about 1.5 that figure.
Sorry,
if that figure was correct, and we had, yeah. So I think that we had 1.5 million cases in Lahore on 30th of April. And if we had 1.5 million cases in Lahore on 30th of April, so even if we consider them to double in the next 1 month, we would have around 3 million cases by May. And we would probably have about 5 million cases today. So I personally
लेकिन डॉक्टर साबिशेख कोई अच्छी न्यूज़ तो नहीं लग रही मुझे. I thought we were going somewhere with it. I thought our cases were decreasing or some positivity would come out of this.
Hello. So what I think is, jo achhi news, what I think is, probably now we have so many people infected with the virus that the virus is unable to find newer hosts. That is what is causing the downward trend. So I think that the concept of herd immunity, if it actually exists, I think that in Lahore, at least, we are getting towards the herd immunity. And I think that the decline is because we are
Dr.
reaching that.
Kamal is enjoying this conversation so much. I think she has some really good insights into the situation. Dr. Kamal, अगर Dr. Tavish की बात पे ही build किया जाए, I think this is a very interesting concept that he just talked about. एक तो ये कि very detailed, insightful information that you've given us, Dr. Tavish. Thank you so much. But just to like एक overview कर ले for general audience, what is your take on like herd immunity, Dr. Kamal? And do you think this is what's happening, or just give us some positivity for the audience?
All right, so it's really hard to be positive and yet realistic at the same time in
Yeah,
this conversation.
I agree with
But yes,
you.
with the first point of Dr. Tabish Raza, I totally agree that somehow we are not actually categorizing or we are not documenting the actual number of the affected patients. Reason one is that people are not coming around to the hospital anymore because they are afraid because being the stigmata or all this problem. And secondly, it is also because people are now preferring to have home quarantine by itself as well,
Yeah.
which is, I think, a good point at the same time. And yes, one study which he has given the reference is 67. Yes, I have read a lot of studies which says that it's between 65 to 70%, which tells about the PCR is like correct, which we say the true positive. And remaining 30 or 25 to 30%, they are false negative. So yes, this is also an undermining number. We have seen patients who have the HRCT findings typical for COVID-19, but they are PCR negative. And now they are going to be treated on the line of PCR since it is pandemic and the findings are typical for COVID-19. So once again, those who are positive on HRCTs but negative on the PCR are not going to be documented. So this is one good example which can tell us about it, right? And then with the great number of population, the government says that 25 test has to be performed. But how many are we performing? I believe we are not documenting, we are under documenting. I'm sorry, I'm forgetting your next question. What was that?
Sorry, मैंने सिर्फ यही पूछा था कि what is your take on herd immunity?
Yeah, herd immunity. So a lot of debate across the world, across the globe on herd immunity. And since being a senior doctor, Dr. Tavish, I would agree on it. But yes, it's a long way to go. I don't think so we can achieve it that early. Yeah, the possibility is that we are.
Yeah, thank you so much for that. Dr. Amara, I would like to build on the last discussion that we had on our question. You were basically talking about how things are starting to open up. Small shops and businesses are starting to opening up and people are going to parks. So how I know things will eventually start opening up and everybody will eventually, have to sort of adapt to this new way of life. But do you think, since a lot of people are talking about, do you think it's here to stay? If yes, do you think the world is sort of, gonna change? And since you're in the next step of the cycle or the curve of how the virus works, maybe you can, shed some light on how that is. And, do you think it's here to stay and this is how life is going to be and we'll just learn to live with it?
Yeah, I think there would be some degree of new normalcy. So yes, through this, we learned the importance of hand hygiene. We learned importance of overall cleanliness of our hospitals, of our buses and trains. So if nothing else, we at least realized how important hygiene is. So I think hopefully that part at least will stay and we'll continue to practice good hygiene. So hopefully that will stay in our hospitals and in our daily lives as well. In terms of what's next, is it here to stay, the new normal? It depends on scientific developments. If, for example, we're able to have vaccine or a successful treatment of COVID-19, then if we have vaccine, if a significant population is vaccinated, then we then we can go back to maybe some of the older ways, but hopefully we'll still practice hand hygiene and other measures. And what's next also is possibly another wave of coronavirus. That's certainly a possibility. Most scientists and experts believe that it will happen, and it may be next fall, next summer. So I think a part of it will be there with us. And then it's difficult to predict what will happen
obviously,
in terms of
because things are changing so quickly and everybody's just learning as they go, so I understand that.
Yeah, and we have some treatments, but none of them are miraculous, and none of them are fully FDA approved. But there's some of them being helpful.
So talking about things that are working and aren't working against this virus, Dr. Tabish, a lot of news around plasma, and the donations and how people are charging so much. So आप थोड़ा इस बारे में बताएं कि how effective is it and how it is affecting people who are being treated that way, and what's your take on people selling it for such high prices?
Plasma, we have used it in a few patients at a very early stage when they start desaturating. We have had mixed results, nothing miraculous, and we are not really unable to determine whether it is beneficial or not. Two of my juniors got sick, and because immediately so many people turned up to donate plasma, so we did transfuse them with the plasma. And they both recovered and they went home, but then there were two patients whom we transfused plasma and they got sicker and they eventually did not make it through. So plasma is still a topic of debate, and the newer guidelines which are coming in are not really that optimistic about it. Again, I'm not sure what they're doing in the United States, but here in our setup, we are relying more on other treatments, especially steroids. We have been using steroids for the last 3 months, well before it was highlighted internationally. And we have had very good results with steroids.
Sorry, Dr. Tabish, I'm cutting you. Steroids wali baat, I'm not sure a lot of people are aware of that. Could you tell us a bit about what it is and how it works?
Yeah, steroids basically are drugs which are anti-inflammatory, and they are available both in oral preparations and IVs. Again, there are several types, and we basically give it to patients, those patients who start desaturating again, and we have very good results with that. Again, steroids is a thing which was only being used in the hospital setting, but recently, paper came out in the United Kingdom, and so our GPs got to know about steroids, and then the GP started to give a lot of steroids to our patients. So that is also reason which we think may be the reason that a lot of patients are not coming to our hospitals anymore, because basically they are being treated by two things. One is oxygen and one is steroids. So the GPs are treating the patients at home, giving them oxygen and steroids. So it's a very good treatment, but I guess it should be used in the hospital setting. The lesser people know about steroids, the better it will be for all of us.
Achha, that was very insightful. I think I wasn't also aware much of the steroids. That is why I built on that question. और डॉक्टर अमारा ने भी काफ़ी अच्छी बातें बताई हैं from an American perspective. डॉक्टर कंवल, आपसे मैं एक बहुत बेसिक सा सवाल पूछूंगी जो I'm sure a lot of people are still aware of at this point in time now, since it has spread so much. लेकिन फिर भी coming from somebody who you can trust, is a doctor and is speaking live and not a WhatsApp message or not a voice recording that you receive on your phone from somewhere, God knows somewhere. So, what would you say are some tips for people to quarantine themselves at home, since they're not going to hospitals but they're COVID positive and they have family around them? What do you think are the basic SOPs they should take care of? The things that they should, manage, and how they can go about it?
So yes, it's a very good question. Keeping in view the increasing number of, can you
Ji,
hear
we can
me?
hear you, Dr. Kaval. Yeah.
All right. So yes, it's a very good question. Keeping in view the increased number of COVID-19 across the world. So first of all, the most important part is that you should have a separate room in a home, and which has a separate washroom or a restroom, which entirely has to be used by the patient or person who is COVID positive. Secondly, yes, I believe, which I personally preach to the people as well, that they should have disposable pots and disposable dishes at home, so that whatever they eat, they just immediately separately waste it and are not used again and again by rest of the family members. Next is take a lot of fluids, try to take multivitamins, try to have a good food. And while person is in quarantine, isolation is itself killing, right? And isolation can lead to a depression, which is going to reduce the immunity of the patient. So it's very, very important to work on the mental health of the patient as well, or someone who is COVID positive. So for that, through my social media forums and then to my patients, I personally encourage them that they should have a good hobby which they can do during their quarantine, and be in contact with your friends and family. And the family needs to have a very important role as well. They should be very encouraging and they should be supportive towards the family. So it has to be all the physical and the mental, both treatments, right? Because isolation leads to depression, which actually is going to cause the quarantine depression. A lot of research is happening on this as well. So yes, a separate room, and it is better to have a room which has a door opening towards outside the home. Not inside, so that there should be but yes, if you have the privilege, then avail it. If not, then that's no problem at all. You can just keep yourself inside the room, have separate dishes, and yes, a lot of food and good food, improve your immunity, and have good hobby which you can use during this quarantine time.
Okay, I think that was very useful, especially because coming from a doctor, you really pointed out one of the most important things. Self-isolation really can lead to a lot of anxiety and depression, and I've seen it firsthand with friends who were COVID positive and they were, self-isolating, and they had very mild symptoms, but they said that the isolation was more, sort of bring them down than anything else. Moving on, Dr. Amara, I have spoken to a few doctors in America, and I do also have some friends working there. I think it is also very important for us to sort of highlight how the governments work, right? So over here in Pakistan, we are looking at a smart lockdown because our prime minister thinks that the country cannot withstand this economic crunch, and we need to let people who are daily wagers or something like that work, because otherwise we will not be able to sustain a lockdown. But from a first world perspective, what would you say your government is, what are the policies your government is putting into action, and how far do you agree with those? I know Trump has said some very controversial stuff, and I'm sure a lot of health workers don't agree with that. But still, what is your sort of point of view on the government's policies with that regard? Sorry, Dr. Mar, your mic is on mute.
You're right. I just unmuted it. So yeah, there's federal government and then there is local government. They both play roles at how you deal with crises like this. So at local level, I think our response was excellent. You're right that obviously this has a huge economic downfall when businesses close, there is no trade, but in developed countries it's probably easier to deal with it and make up for it when things do reopen. And but in Pakistan it would be difficult to sustain an economic downfall because you're already starting at a low economy. But there was serious economic setback here too. Our governor in New York State said that the state is essentially broke because so many businesses were shut down. It did affect a lot of individuals too. Yes, a lot of people were fired because businesses were not operating. The numbers of unemployment were at an all-time high during this pandemic because of businesses being closed, right? But there is a social safety network in America where you can apply for unemployment. So if you're unemployed, if you're skilled and you're unemployed, you can apply for unemployment and get at least basic sustenance wage that you can live off of for a few months. So that's what people here did, applied for unemployment. But again, the unemployment claims were also very high, and that department was taking a lot of time to process applications too. So it took toll at every level.
So I was just wondering, like, so this is you've tapped on the economic perspective of it, but from a government policy perspective, do you think, yeah, so just build on that a little.
Yeah, government policy, obviously you have to take everything into account. Yes, I know Imran Khan said that if you close down everything in Pakistan, you will not be able to, a lot of people will not be able to get food or have shelter. But at the same time, if we let things continue, the virus will spread and that will kill people too. So I think there has to be a very fine balance at establishing such policies. So here we close in, governments at federal and local level closed down everything and then started reopening, and we were government policy was to reopen in phases, and then you could monitor the number of cases. So if you started phase 1 first and then you monitor cases, so everything's going good, the cases are not going higher, then you open more businesses. So at least that's how the government operated in New York City to do it, in phases and level by level and monitoring cases. So that was the helpful policy.
Yeah, I think that is sort of the ideology that even Imran Khan had in mind, but obviously it plays out differently when people are not adhering to the set of SOPs laid down by the government. It's easy to say that this is what you have to follow, but it's hard for them to follow when they don't even believe in the severity of the situation. तो I think building on that, Dr. Tabish से मैं पूछना चाहूँगी next कि although very sad, but बहुत ज़्यादा लोग इस तरह से, I think ये बहुत, I don't know if it was like a conspiracy or whatever, लेकिन बहुत ज़्यादा चल रहा था ये कि डॉक्टर्स पैसे ले रहे हैं to declare somebody COVID positive. आप सबने भी जरूर सुना होगा ये, और आई एम श्योर अपनी जान मतलब रिस्क पे रखते हुए जब आप काम कर रहे होते हैं हॉस्पिटल में और आपको इस तरह की बातें सुनने को मिलती हैं सोशल मीडिया पे, आई एम श्योर इट माइट हर्ट अ लॉट. तो फ्रॉम समबडी हु हैज वर्कड on the front line and has been working just in the health sector for so many years, Dr. Tabish, आपका क्या perspective होगा इस बात पे, और आप क्या कहना चाहेंगे people who are spreading such information कि असल में situation कैसी है और उनको कितना sensitive होने की जरूरत है इस बारे में कि you कोई पर्सनल गेन नहीं हो रहा किसी डॉक्टर को इससे? सॉरी, आई थिंक डॉक्टर ताबिश का जो है ना स्टक हो गया.
ऑनेस्टली बताऊं जी कि
ओह अच्छा, ठीक है. ओके, नाउ इट्स वर्किंग.
मैं ना जी ऑनेस्टली बताऊं, इफ आई हैड अ चॉइस. हेलो जी, कैन यू
जी
हियर
जी,
मी?
वी कैन हेयर यू. जी जी जी.
जी, if I had a choice, if I had a choice, and if I was not employed in a hospital, probably these 4 months or 5 months, I would have.
सॉरी, आई थिंक डॉक्टर ताबिश का इंटरनेट थोड़ा सा इशू कर रहा है. Dr. Tabish, I think I'll revert this question to Dr. Kaval instead, till I think your internet sort of fixes itself. So in the meantime, I'll ask Dr. Kaval the same
Stayed
question.
home and would not have left home. Hello.
Dr. Tabish, आपकी bandwidth थोड़ी low है इस time, so I'll just revert the same question to Dr. Kaval till your internet can, sort of balance itself out. ठीक है, Dr. Kaval, can you answer this question for us?
Yes, yes, I will continue until Dr. Tabish is back. So yes, it's very unfortunate that we
Hello.
are hearing this story. Shall I continue?
Yes, you can. I think Dr.
Hello.
Tabish का internet उनको पता नहीं लग रहा अभी. Dr. Tabish, I'm just asking Dr. Kamal the same question. We can hear you, but Dr. Kamal, you can continue.
All right. So yes, unfortunately, we have been hearing some stories across the hospital, and the reason being is it's really stressful. It really hurts me, to be honest, that behind so many PPs where we hardly are able to breathe and we hardly are able to drink and eat anything, and we have actually put our lives at risk just for these people, and they are actually putting such blames on us that we are asking for money. We never graduated. We never made so much hard work just to kill anyone. We are actually very much honestly working as a whole team. We are trying to save people in every possible way, putting our lives at risk. I have been hearing people that especially from Lahore Mayo Hospital, that one of my very close friend, her husband was pushed into the COVID ICU ward without PPs by the attendants, claiming that this is all drama and there is no corona, and you guys are just asking for more money. And his wife, which is my close friend, was standing outside and she was controlling the mob. And this is so traumatizing. We have got so many scars on our faces and across our earlobes and trachea just because of wearing these masks all the time. So yes, this is really unfortunate, and this needs to be clarified to everybody that this is no such reality. We are not claiming any money. We are working within the same limitations as we were before Corona. There are no leverages, no privileges we are getting.
No, thank you so much for that, Dr. Tavish. I'm sure your internet is working properly now. Same question ही होगा आपसे अभी भी. Could you build on that now for us?
Yeah. So I was saying that if it was up to me, I would not leave my house during the 4 months. Unfortunately, I had little, and we had to go to the hospital every month. Doctors are getting anything extra, and COVID-19 is a nightmare for all of us. Every day we go at risk of getting infected. During the first 1 month of this infection, I left my wife and my two kids at the grandparents' place, and they were there. They had to come back, and now they're here. So what I do every day is I wear my scrubs. I go to the hospital. I'm wearing a surgical mask. Then N95 mask and a face shield. That's what I'm doing everywhere. And then I'm going inside the medical PR or the isolation wards, I'm wearing the PPE. And it's really exhausting. And again, I'm not getting any extra doing that, except for the risk which I have of getting the disease. And when I get back home, it's a long process of trying to disinfect myself. The car which I'm using, only I'm using this. I don't use that car when I'm going out with family or anyone. As soon as I enter the house, the shoes are left outside the house. I don't bring them inside. I go straight to the washroom. My scrubs go straight into a detergent and water, and they're soaked in the detergent for about 5-6 hours. I take a shower with soap, and only after that process I go near my kids. So it's a very exhaustive process, but I would like to say one thing. It's been 4 months. Alhamdulillah, I have remained like I've been saved from coronavirus. So I think what has saved me has been two things. One have been that I've been very strict with my masks. I've not taken them off anywhere. When I'm with any person, whether outside the hospital or inside the hospital, I'm not taking my mask off. Plus, whenever I touch anything, I'm using my hand sanitizers or I'm washing my hands. So I personally think that the highest chances of getting the disease when you're inside them for grocery or I'm doing for anything else. And you're wearing a double mask, which is a surgical mask, N95 mask. And as soon as you are over with your grocery, you sanitize your hands properly. I do not think that you will get COVID-19. You get COVID-19 when you're careless, when you're not wearing your mask properly. There's a procedure called fit test which you do. You can do it in Pakistan as well. You can tighten your mask and you can blow in and blow out, and you can see whether the air is coming out. So if we can just educate people on how to wear the mask properly and sanitize their hands properly, I think you can remain very safe from coronavirus.
Thank you so much, Dr. Tavish. काफी insightful था ये भी. और मतलब मेरे लिए it's really fascinating how you guys step into a hospital and work on the front line and still manage to fight it off. और हम इधर घर में बैठे होते हैं, even if we're getting like packages delivered or something, we're really scared, oh, will we get corona because of this? So it takes a lot of courage to be on the front line, and it also takes a lot of strength to go and come back every day and then sit with your family and not let your mind sort of divert to negative thoughts like, oh, what if I infect somebody over here, or what if somebody in my family falls sick because of me. So I think it's commendable, and so I guess thank you for joining us today. It's been a very insightful session, and I'm sure बहुत सारी बातें हमने ऐसी भी की हैं जिससे काफी लोगों को हेल्प हुई होगी, काफी लोगों के मिसकंसेप्शंस क्लियर हुए होंगे, और मेरे लिए तो काफी यूजफुल था. आई मीन आई डिड नॉट नो अ लॉट जो मुझे आज पता लगा इस सेशन से. तो आई थिंक थैंक यू डॉक्टर अमारा, डॉक्टर कंवल, डॉक्टर ताविश, आप सबका बहुत थैंक यू फॉर टेकिंग टाइम आउट. बहुत बिजी स्केड्यूल चल रहा है आजकल डॉक्टर्स का, सो इवन गेटिंग 3 of you online today, I think it's a big privilege for us. And thank you to COLABS for organizing this session. It's been a wonderful session, and I think we'll continue with our health hour next time, and you guys should also keep watching us. Thank you.
Thank
Thank
you.
you.
Bye.
Thank you.
Bye.
Thank you.
That's it.